How long does eye droop last after Botox? People who have had Botox injections often wonder how long the effect will last. It's an extremely common complication, and the majority of patients will see the major effect fade after a few weeks. However, some patients may experience intermittent drooping. If you experience this complication, be sure to notify your doctor immediately. In rare cases, your doctor will prescribe eye drops to counteract the effects. Although this side effect is very rare, you should be aware of it. Unlike other procedures, Botox will only last for a few months. If you have drooping eyelids, you should see improvement in 2 to 6 weeks. If the drooping remains, you may want to return for a second session. It is important to note that this side effect may occur if your liver is diseased or inefficient. A second side effect is bruising. This is due to the fact that Botox is not metabolized by the liver. This could cause increased bruising. It's also important to note that you should consult a board-certified dermatologist or plastic surgeon before getting Botox injections. Your physician may use too much or inject the wrong area, so you might experience more bruising. How do you fix droopy eyelids after Botox? Droopy eyelids are a common side effect of Botox. This side effect is temporary and should go away after 3 to 7 days. The doctor will recommend a different treatment to correct the problem. If the effect is still noticeable after 3 to 7 days, you can try an eye drop. This should help you temporarily. If the drooping continues, you should call your doctor and ask for an alternate procedure. A doctor can give you the same results after Botox treatments as a non-Botox injection. If you have droopy eyelids due to the wrong method, you should follow your physician's recommendations. Generally, name brand solutions work just as well as Botox. A good surgeon will use the right depth of the dermis. Your eyes will look brighter and more rested, but you should be aware that some patients may still have eyelid ptosis even after Botox. Often, a simple muscle massage can awaken droopy eyelids. Many experts recommend massaging the area with an electric toothbrush for a day or two after Botox treatment. This can help dissolve the drug. However, you must wait for at least a full day before massaging the area. The neuromodulator aproclonidine signals muscles to contract, raising the eyebrows by 1 to 2 millimeters. Is ptosis permanent after Botox? The effects of ptosis after Botox injections are temporary, but they can be very painful. Most patients experience drooping eyelids within 4 to 6 weeks of treatment, but this is only a short-term side effect. After that, the condition usually subsides. However, if the condition is persistent, it can lead to permanent eye problems. Ptosis is a common side effect of Botox injections. In a majority of patients, it can last between 3 and 14 days. However, this time frame does not include the time it takes to see the effects. Because of the sensitivity of the nerves in the face, Botox can cause a variety of side effects. Several of these side effects may be permanent, and in most cases, the side effects should subside within 4 to 6 weeks. If you are wondering if Botox will leave you with drooping eyelids, it is possible to get them permanently fixed. but it is best to seek a qualified medical practitioner for the procedure. They are familiar with facial musculature and can make informed decisions regarding the right locations for injections. A well-trained cosmetic surgeon will be able to minimize the risk of ptosis by following proper injection guidelines. If your ptosis is caused by nerve issues, your doctor may recommend surgery or the use of an antidote to reverse the effects of the Botox. The antidote is difficult to find and takes a few days to begin working. But if you are concerned that your eyes are permanently affected, you may want to consult with an eye doctor to get a second opinion. How do you fix a droopy eyelid fast? One of the most common questions patients have is, how do you fix a drooping eyelid fast? The good news is that you can get it fixed quickly. There are several different ways to do this, and each one will have different results. If you have a droopy eyelid, you may be wondering how to get rid of it. To help you, we have a few simple solutions to help you get back to your life. One of the best ways to fix droopy eyelids is to perform exercises. These exercises can help you get rid of the droopy skin and make your eyelids appear lifted. Some people find that massaging their eyelids can make them feel softer and a bit more comfortable to work out in. Using chamomile tea bags as a compress can also give you the results you are looking for. Another method is to use a chamomile tea bag. These are anti-inflammatory and can be placed over your eyes for 20 minutes. You can continue using this remedy regularly to improve the look of your eyelids. You can also make your own lotion and apply it to your eyelids. Once it has dried, remove the bag and rinse your eyes thoroughly with cool water.